Every year, an estimated 30,000 to 62,000 Americans die due to catheter-related bloodstream infections. Until recently, it was thought that little could be done to prevent these infections, but an ongoing partnership between several key healthcare stakeholders is making major strides. I'm Haydn Bush, Senior Online Editor for Hospitals and Health Networks magazine, and I'm joined today by Dr. John Combs, President of the Center for Healthcare Governance at the American Hospital Association, to discuss the comprehensive unit-based safety program, STOP BSI. John, thanks for joining me today.
You're welcome.
So John, I'd like to get started by having you tell us a little bit about CUSP, STOP BSI.
This is a project that has been going on now for about 3 years. We have one more year in our grant from the Agency for Healthcare Research and Quality. It's an $18 million grant to take the work that was done by the Michigan Hospital Association back about 7 or 8 years ago, where they were actually able to take their central line associated bloodstream infection rate down to 0. And that means every time they insert a central line catheter in their ICUs in Michigan, the chances of a patient getting an infection is 0. Whereas the rates used to run about 5, 6, 7 per thousand catheter days. So this is really a remarkable achievement that they made. And now AHRQ has asked us to take that experience and bring it to scale across the country, to have this done in every state in the United States.
And what are some of the preliminary findings from the field as you move this nationally?
In the first 4 cohorts, which consist of about 35 states, and we have enrolled 45 states around the country, in those first 4 cohorts, we have reduced the rate by about 33% to a rate of about 1.2 per thousand catheter days. Our goal is to get it below 1, and we really think that with a concerted effort we can get to 0. In fact, 60% of the hospitals that have participated in the project have a 0 rate currently. About another 20% have a rate between 0 and 3, and there's still about 20% that have a rate above 3. So we're working very closely now with those high rate hospitals to help them bring that rate down. And our goal ultimately is to eliminate these infections entirely.
And in terms of doing that in a specific facility, what are the big picture kind of keys to making that happen?
Well, there is an approach that has been developed by Johns Hopkins, which we know will work in terms of reducing the infections. And that approach, quite simply, is to make sure that the person inserting the catheter is gowned fully, gloved and masked, that use chlorhexidine to clean the site for the introduction of the catheter, that you don't use the femoral site, which is much more likely to get infected, and that you really do scrupulous dressing changes and make sure that lines that are not needed are discontinued. Now, that's very simple. That's almost what they describe as the checklist. I think the magic in the CUSP approach developed by Johns Hopkins and Peter Pronovost is that it is a comprehensive unit-based safety program, CUSP. And it's comprehensive in that it addresses both the cultural issues as well as the technical issues. We can solve the technical issues quite easily. The knowledge is out there and we know how to do it. It's really these adaptive issues. How do you get people to do it consistently, to challenge each other, and most importantly, to hold each other mutually accountable for the care of the patient? And that's the beauty of CUSP, because it addresses both the technical side and the adaptive side, or the cultural side.
So you're really trying to kind of enact a widespread cultural change in these institutions.
That's exactly right. That's the only way we're going to make any progress in this whole journey for quality and safety. The cultural side of it says we all have to hold each other accountable to what we know and to keeping the patient at the center of what we do.
Well, John, that's all the time we have for today. Thanks so much for joining us.
Well, thank you.